And I think you'll all be aware on the call this morning that the COVID-19 pandemic has and will continue to place women, children and young people at increased risk of harm. Where home should be seen as a safe place and a haven, the challenging times that we're all faced with, unfortunately for too many individuals across Scotland, home isn't that safe place or that haven. The pandemic and the restrictions that it has placed upon our communities has provided an opportunity for perpetrators of violence against women to exert control, abuse and exploit those that already face a greater risk of harm. Women and children now have less opportunity to seek or help or support from their normal social networks, such as friends, families or professionals. And irrespective of the roles that we in this group today undertake, whether it's in a statutory role or a third sector role, we have all witnessed firsthand the impact that COVID has had on women and children who experience gender-based violence. We all know and realise that our own services are being stretched and tested, that our staff are often working in isolation to deliver that specialist support. But this is only based on what we actually know. And I'm sure, like many of you, you will share the fear that an awful lot is not being reported. Violence against women and girls is a widespread problem that occurs at an alarming rate across Scotland and across the world. The United Nations recently reported that 1 in 3 women have experienced some form of physical or sexual violence at some point in their lifetime. For me, that's a figure that really shouldn't exist in today's society. The outbreak of the pandemic has only intensified violence against women and girls. And recently, the United Nations referred to violence against women and girls as the shadow pandemic. And that's something that I probably agree with, and I'm sure many of you will also. This shadow pandemic is growing, and it's possibly been accelerated by the very measures that were instigated to control the spread of COVID-19. For many living with gender-based violence, the factors which trigger or perpetuate violence have only been compounded by the measures that were instigated. And for many perpetrators, they are more able than ever to exert that control, power and coercion, with victims often being left isolated and unable to reach out for help. We also know that unemployment, potential for economic instability and stress may lead to perpetrators feeling further loss of power, which can only exacerbate the frequency and severity of their own abusive behaviour. Additional barriers have also inadvertently been created, with many victims being unable to access services, support and help. And as victims feel further isolated from that assistance and support network, their own health and well-being will impact, it will worsen, and the risks will only increase. The underlying cause of our own shadow pandemic is not the virus itself, but it's that imbalance of power and control, an imbalance that stems from inherent discrimination, discriminatory attitudes and beliefs. Every one of us here today has an important role to play. And today's event will allow us, firstly, to examine how we can transform our systems and services, to provide an opportunity to develop an awareness of the prevalence and the impact of trauma on women and children affected by violence. Thirdly, to strengthen our own understanding of trauma-informed practice and policy and help us build a trauma-informed approach into our long-term recovery, our renewal and our transformation.